All right, we're going to be talking about cognitive disorders in the aging populations of Alzheimer's and dementia presentation. Now, we're going to do a quick overview of dementia, as dementia is a more complex condition that leads to various cognitive challenges and has multiple causes, which is more identifiable through specific brain features. And since dementia is more of a broad umbrella term, therefore, there are different subgroups that go and coincide, again, with the specific brain features that are affected. And understanding these differences is essential before examining how they impact on the elderly, because certain types of dementia is more severe in other cases, but still can have negative consequences nonetheless on the individuals. Now, dementia is caused by brain changes like beta amyloid plaques, which is Alzheimer's, poor blood flow, vascular dementia, cell loss in Lewy bodies, dementia of Lewy bodies, or shrinkage in the frontotemporal lobes, frontotemporal dementia. It can also result in conditions like Parkinson's disease, Huntington's disease, HIV, or brain injury. This is from Werigan and Bondi, 2011, page 1. In figure 1, we can see in comparison of a healthy brain and Alzheimer's brain with the reduction in size due to shrinkage. Again, we can see the plaques, the tangles, and the diseased neuron. With the alteration of the brain, we can see that the new-founded brain of the individual with dementia can correlate to how they are going to be able to function in society, meaning that now we're having a new destruction of brain, which will make an individual more prone to develop cognitive declination. Now, next, we're going to be talking about how elders with cognitive disease are more uniquely vulnerable, as they're facing additional challenges from not only the cognitive declination and other age-related health issues, but now we're going to further explore the other challenges they face. And we're going to do this by including trends, demographics, looking at cultural differences, the inequality that they face, and the role of family, healthcare, and community support, which can help alleviate some of these issues, which in this case is important to understand this population because it highlights the need to be able to show empathy and support and to gain the further understanding of what these individuals truly go to. Now, we're going to talk about the percentage of the overall elder population affected by cognitive disorders. If we look at figure 2, we can see that based on this pie chart, we can look at the different subgroups of ages, and the most prevalent to be affected in respondents in 2024 were the age groups of 75 to 84, which were 2.67 million cases of Alzheimer's dementia were recorded. Now, in correlation to figure 3, we can see that the increasement in the progression of generations is estimated through this projection of, again, from the same Alzheimer's Association resource. We can see that from 2020, we see the 6.1 to 13.8, almost double the estimation of how people will be affected. And as the number of individuals affected by Alzheimer's rises, understanding these demographic trends and diagnosis and growing prevalence due to aging populations is essential, because according to Alzheimer's Association 2024, page 35, the older adult population is growing due to lower fertility rates and improved life expectancy, a trend called population aging. As fewer children are born, older adults will make up a larger share of the population. Since age is a main risk factor for Alzheimer's, the number of cases will rise, and by 2060, it's projected that 13.8 million people aged 65 and older will have Alzheimer's unless medical breakthroughs occur. Next, we'll be looking at the demographic factors of the components of age and gender. Now, as people age, we're seeing more cases of dementia because for people living longer, there's a higher chance of developing these conditions influenced by factors such as age and gender. And when we understand these factors, it helps us see how dementia affects each person differently. Additionally, with the increase of age over generations, healthcare systems must prepare for a higher number of cases of Alzheimer's. Now, looking at figure 4, we can see that this graph shows the gender disparities in dementia risk, highlighting that women are more susceptible to developing the condition, and we can see this with the percentage rates in comparison to males and women. Now, nearly 2/3 of Americans with Alzheimer's are women, and of the 6.9 million people aged 65 and older with Alzheimer's, 4.2 million are women and 2.7 million are men, making up 11% of women and 9% of men in the age group. While women live longer and age is the biggest risk factor, studies show no significant difference in Alzheimer's risk between men and women of the same age, although age or region may influence this, which was founded by Alzheimer's Association 2024, page 30. Next, we'll be delving into the demographic factors of ethnicity and region. Now, additionally, disparities in dementia affect minority groups who often face greater challenges than others, and the prevalence of Alzheimer's and related dementias, ADRD, varies by race, ethnicity, and gender, with certain ethnic groups experiencing heavier burdens than others. Now, although more whites live with ADRD than any other U.S. racial ethnic group, we can see that significant racial, ethnic, and gender disparities exist, and ADRD is prevalent. Older Latinos and Blacks are more likely to be affected. Projection shows that over 43% of Blacks and 40% of Latinos will bear the greatest ADRD burden by 2060. ADRD prevalence is higher in women than men, with Latinos expected to see the largest increase in cases. This was founded by Aranda, 2021, page 5. If we can look at the charts of figure 5 and 6, it kind of will correlate with each other. We can see that based on the graph, let's just look at the graph, for instance, we can see that African Americans and Hispanics have the more higher percentage. And in the case of the regions, we can again see that based by the little key chart, again, Hispanics and Blacks who are more prone. And therefore, these vulnerable groups are more susceptible in these diseases due to the lack of focus on their needs. Additionally, the fact that women are more likely to develop ADRD than men is important for creating targeted interventions and support systems. And this highlights the need for greater awareness and policies to address these disparities and lessen the future impact of ADRD. Next, we're going to be talking about the cultural beliefs about aging and cognitive issues. Okay, now we're going to be exploring how different cultures view dementia reveals that cultural beliefs influence care and treatment, while also shedding light on societal interactions with those living with cognitive disorders. Examining these perspectives help us understand the stigmatization and prejudice faced by individuals in the dementia population. Now, in the UK, people with dementia report facing significant social barriers, with 27% feeling isolated, 37% experiencing loneliness, and 48% viewing themselves as a burden. In the US, stigma is a key barrier into seeking help and contribute to economic exclusion and exclusion from medical decisions. Media and arts representations also tend to dehumanize those with dementia. And in China, stigma is more overt, with the term Lanoya Shiri, which might be the incorrect pronunciation, please forgive me, meaning stupid, demented, elderly. day, leading to widespread ignorance, ridicule, and isolation for those affected. This was brought by Craig, 2024, page 3. If we look at the figure 7, we can see that based on this infographic, we can identify common elements of perceptions among these three cultures, helping us form a more unified understanding of how this population is viewed globally. Now, in Chinese representations, concepts like family and assistance highlight the cultural value of familial care, while elements like irreversible and treatment indicate a shift towards recognizing the role of medical intervention in dementia care. The inclusion of dependence and inconvenience points to caregiving burden linked to cognitive decline. The British representation, with its focus on living well, reflects a person-centered care approach, emphasizing empowerment and emotional aspects of dementia. Meanwhile, the American view, marked by nursing home and disabled, underscores dependence and isolation with less emphasis on family care, and this reflects a broader tendency to treat individuals as less than human, reinforcing the dehumanization perspective of cognitive decline and institutionalization in U.S. care. This was founded by Craig, 2024, page 17. Now, cultural perspectives on dementia show how it is treated and understood differently across cultures. Exploring these views can help us understand how caregiving practices reflect each culture's values and beliefs. Next, we'll be talking about education and inequality, focusing on the economic challenges first. We are going to talk about this and relevance to each graph of figure 8 and figure 9. We can see that with AD, which is Alzheimer's disease, is solid versus without AD, we can see that there are more expenditures of individuals who have Alzheimer's. As well as the pie chart, we can see how the expenses are more divided to how they're going to be able to pay for these expenses among them. We can see that Medicare is more predominantly able to take a good chunk out, but you're still left with the out-of-pocket expense and the other expense, which leaves more of this population susceptible to experience poverty and or financial struggles. In turn, can also play an effect in towards their caregivers who are more reliant, such as families that are caring for the person, also experience the struggle by being the one who has to initially pay out of pocket. Now, the economic burden of caregiving and long-term care expenses is growing a concern, especially as the number of people living with dementia, PLWD, continues to rise. Now, the rising number of PLWD will create an unsustainable economic burden on individuals, families, and healthcare systems. These estimates often overlook the financial strain on care partners who face wage losses, higher healthcare costs, and other expenses like home occupations and early retirement withdrawals. Economic impacts may affect future generations, with adult children potentially selling homes for care costs. Care partners, especially Black, Latino, and less educated individuals, face higher out-of-pocket costs, with Latino and African American women spending significant portions of their income on caregiving. This was found by Aranda, 2021, and I believe it was page 7. I just forgot to include that. These disparities show the urgent need for intervention to ease the financial burden on caregiving. Without any action, the economic gap between caregiving groups will just keep on growing, especially if communities are already facing disadvantages. Next, we'll be talking about the access to healthcare and long-term care. Now, disparities in end-of-life care further highlights the challenges faced by Black and Latino individuals with dementia. Now, as Aranda 2021, page 8 notes, evidence highlights healthcare disparities for Black and Latino individuals with dementia, including delayed or incorrect diagnosis and challenges in accessing services, especially for Latino and Asians, such as racial and ethnic differences in treatment, with Black and Latino individuals less likely to receive or continue anti-dementia medications. There's also a troubling rise in antipsychotic use among Latinos and higher hospital mortality rates for African Americans and Latinos. Additionally, they are more likely to live in an under-resourced nursing home with higher COVID-related deaths and are less likely to engage in advanced care plan, leading to more intensive, costly end-of-life care. These issues may be linked to differences in care preferences. Now, cultural attitudes are important, but addressing healthcare access and trust through policy change and increased minority representation is equally crucial in improving this care. Additionally, government programs like Medicare and Medicaid play a key role in influencing healthcare costs, as Medicare covers home health and up to 100 days of nursing home care, while Medicaid covers long stays. New benefits like the annual wellness visit could reduce costs through early detection, but utilization remains low, and the post-acute care incentives have lowered Medicare costs, but may shift expenses to families. Most studies focus on traditional Medicare, while over a third of beneficiaries are in Medicare Advantage, which offers care coordination. Its impact on PLWD is unclear, and dementia cost estimates may vary, and this was founded by Aranda, 2021, page 10. Now, understanding dementia care costs is essential, as Medicare and Medicaid have limits, often leaving families rely on their personal savings. Programs like annual wellness visits can help reduce costs, but again, they're underused limit savings, making crucial to recognize these factors to better managing care expenses. Next, we'll be talking about the employment history. Now, regarding employment for older individuals with cognitive impairment, the decline in skills may impact their ability to work, which in turn could affect their capacity to maintain employment. Now, soft skills are considered extremely important in many occupations and industries, and the impairment of these skills due to emerging cognitive difficulties make it difficult for dementia workers to continue to work. This is confirmed by Worak, Kordas, and Korshewski, who found that any impairment in mental health can result in unemployment. This, again, is Savagi, Leonardo, Tabashi, Mushio, Topio, and Raggi, 2020, page 9. Now, it's important to note that the severity of cognitive impairments can influence whether individuals are able to work, with accommodations from employers potentially enabling them to perform their duties despite the decline in mental health. Now, on the other hand, some patients in mild stage of dementia retain the ability to work, provided the adjustments to the activities made by employers, as shown in a recent qualitative report. This consists of worksite interventions to provide an opportunity for people with EOD to undertake tailored activities, with constant presence of staff supervisors. This was found on Savagi, 2020, page 9. Now, this challenges the belief that people with cognitive impairment can contribute to society. Workplace accommodations support their independence, dignity, and financial stability, enabling them to live the fulfilling, productive lives that they can and should be able to have. Next, we'll be talking about the retirement savings challenge. As previously mentioned, dementia is financially burdensome, and employment worsens this by increasing the risk of debt or poverty. Early retirement may force individuals to deplete personal resources to cover care costs, causing significant financial strain. Occupational health professionals can help patients continue working. This, besides the aforementioned positive effects for workers and employers, may in turn impact on the indirect costs of dementias. That is, those connected to premature retirement, which account for approximately 36% to 60% of total dementia costs. Okay, next we'll be talking about the social and medical policies. Social policies affect people with dementia differently from other older adults due to their multiple chronic conditions and higher risk of hospitalization. And as noted by Byram 2014, page 25, new payment strategies aimed at improving care coordination and reducing hospital readmissions are not specific to Alzheimer's or related dementias. However, these strategies can significantly impact people with dementia as they often have multiple chronic conditions and are at a higher risk for hospitalization. And policies that integrate Medicaid and Medicare along with improving nursing home care will significantly affect those with dementia, who make up a large portion of residents. Some states are exploring more affordable options. About 75% of people with dementia require nursing home care, and 2/3 of nursing home residents have cognitive impairment. The annual cost is around $75,555. Many deplete their assets before qualifying for Medicaid, which covers 2/3 of the nursing home residents and 62% of the cost, straining state budgets. To reduce nursing home placement, states may have offered some Medicaid-funded home and community-based care options expanded under the Affordable Care Act. This is founded by Byram 2014, page 25. Next, we talk about the systematic inequalities affecting care access to resources. Systematic inequalities create barriers to create care for minority groups. Language and cultural issues hinder Alzheimer's diagnosis in Hispanic Latinos, while African Americans face greater distress, worsening the burden. Addressing these disparities is key to improving care and reducing Alzheimer's impact. The ethno-racial disparities affect the presentation and long-term impact of Alzheimer's disease (AD). The growing Hispanic Latino population often faces lower educational levels and healthcare access issues, leading to undiagnosed cases. African Americans experience higher psychological distress, contributing to higher AD rates compared to non-Hispanic whites. These disparities may arise from diagnostic barriers, racial bias, and cultural attitudes towards mental health. This is founded by Rossio, 2021, again, page 4. I just keep forgetting the page number. I'm so sorry. Next, we're talking about the role of caregiving and challenges. Now, some husbands struggle with housekeeping and providing healthy meals, whilst many wives feel the caregiver role aligns with their spousal expectations. Family caregivers also take on various roles like supervisor or facilitator, depending on the situation. Shifting between these roles is described as becoming full-time actors, with the caregiving stage ending when the spouse or partner leaves permanently. This is founded by Steinfeld, 2021, page 4. Cultural expectations and policies implications often pressure families into taking on caregiving roles, leading to a range of challenges for them. According to Steinfeld, 2021, page 11, caring for a person with dementia full-time is a heavy burden that leads to social isolation and emotional distress for family caregivers as they cope with the loss of someone close. The responsibility often leaves caregivers with little energy for their own needs, affecting their health and well-being. Family caregivers face a range of needs, including social support, information about dementia, and help with daily care activities, as well as respite to allow for self-care. Next, we talk about community and recreation. As mentioned in the presentation previously, people with dementia often face negative views and they make them feel excluded or isolated. Therefore, implementing dementia-friendly communities makes it easier for these individuals to access support, stay independent, and feel included. These communities reduce stigma, encourage social connections, and help people with dementia feel respected and maintain their dignity. Now, geographic DFCs, which is the dementia-friendly communities, aim to transform entire communities to be more inclusive and supportive of people with dementia. This approach focuses on making the physical environment more accessible with features like clear signage, rest areas, dementia-friendly design. It also encourages local stakeholders, including businesses and residents, to collaborate in supporting those with dementia. This is founded by Craig, Halloran, Stark, and Wilson, 2024, page 3. Now, recreation activities tailored to chronic needs are often deprioritized in care homes due to limited funding, staff shortages, and a focus on residential physical rather than on psychosocial needs. Policies view activities as regulatory requirements rather than essential care, and emphasis on qualitative outcomes further limits meaningful engagement. Additionally, staff knowledge and skills in dementia care impact the ability to provide person-centered activities. Now, both of these community and recreation purposes are needed to be able to make people of this population feel like they are still a person, and not being able to supply entertainment as well as being able to navigate in their own society makes it hard. So therefore, these two implementations within someone's own culture would be able to allow for individuals to feel like a person once more. Next, we're going to be talking about narratives from elders with cognitive disorders. Now, this is their first person narrative, meaning that this is their story. Now, from Alzheimer's Association, California, Nevada, 2014, at 3 seconds, it started. I remember my daughter crying after I told her, and she said, well, what does it mean? I'm going to get it too. I don't know whether she was more upset about the fact that I was telling her that this was something she had to fear. Now, this was in correlation to a mother telling her daughter that she had, in fact, dementia. Her daughter was more upset about, whether she was going to get it. And, there was just a whole mix of emotions. But obviously, that memory impacted her because that's the first thing she mentioned when she found out about her diagnosis. The next narrative was from Dementia UK 2023, page 2. I was team manager last year, but I had to give it up. I couldn't give team talks as I would lose my train of thought mid-sentence and completely forget what I wanted to say. I decided to step back from the management position and focus on playing. Although I'm not playing to the level I used to, I'm still really enjoy walking football. I met a lot of people who have been very good friends. My teammates have been very supportive in my diagnosis. We still have lots of fun and banter and changing rooms like in the good old days. Now, when I read this, I was kind of confused and towards the correlation of the good old days. Perhaps this individual felt that, this change of having this diagnosis has now made them kind of developed and changed from the person they once were. I mean, yes, it has that function, but it's clear that obviously getting this diagnosis shows that there are different reactions towards how other people are perceived, as well as self-perception of yourself. So it's pretty interesting. Next, we're looking at the narrative from caregivers for elders with cognitive disorders. One states, I lost the man I knew as my husband a long time ago. So not only have I lost a husband, but the boys have lost their dad. My mother-in-law has lost a son, and my our grandkids, really, they're only known him as he is now. So it's a huge loss for the whole family. The Kansas City Star 2013 started at 4:06. Now, this is important because during this, we are meeting someone who is a caregiver to their husband, who is now kind of showing signs and symptoms of being more aggressive and kind of forgetting who she is. And this in correlation is making her feel as if, she's disconnected, disassociated with the person she once knew, which in turn can have more of an effect on family roles. The next one is you learn through each stage that your loved one goes through. I can't get a smile out of his face, but I know when he reaches out for that hug that his emotions are there. The emotions don't go away. Even if they can't talk, they'll be demonstrated in another way. Founded by Alzheimer's Society of Canada 2021 to 21 it started. Again, this kind of both different reactions of how each caregiver kind of perceives. One is kind of more at a breaking point, at a loss. The other one is more accepting, wanting to continue, is doing the best to be understanding. And obviously, different individuals are going to react to different ways because, again, there's different severities of dementia and different ways that they impact people. So, again, it distorts the whole family structure and can, negatively impact on their relationships. In conclusion, looking at elders with cognitive disorder shows how their identities, roles, and relationships are affected. Alzheimer's and dementia disrupt their sense of self, causing stigma and isolation. However, supportive communities can help them feel valued and included. As the population ages, understanding cognitive decline and changing societal views is important. Promoting empathy and support can improve outcomes for this population.